PhilHealth still has to pay the Philippine Red Cross more than 1 billion pesos in debt before COVID-19 testing can resume. The Red Cross chairman, Senator Richard Gordon, says some private companies are taking advantage of the situation, charging up to 20,000 pesos for testing. The senator also warns of a possible surge in COVID cases in the country. Joyce Idas joins us live to tell us more. Joyce?
Yes, Senator Richard Gordon says the contract between PhilHealth and the Philippine Red Cross states that testing expenses should be paid 3 days after submission of the bill. He notes that his office has been submitting their bills to PhilHealth every day, but it's been 50 days since the government health insurer last paid them. And now they continue to wait for PhilHealth to shell out more than 1 billion pesos for the last 303,000 tests given to overseas Filipino workers, government health workers, police, and soldiers. Gordon says he received information that the check for payment is ready and just waiting for one signature. Now, the Philippine Red Cross chairman believes PhilHealth may be, quote, trying to be very careful to the point of stupidity. Let's listen to Gordon.
I don't think duwag si Dante Giran. Ito panibagong mundo. He's like a new guy in the block, surrounded by all kinds of snakes and jackals and hyenas. Natatakot siya. Natatakot siyang gumalaw. That's one explanation. Human beings are endangered. They're very reckless, very irresponsible. And sa Tagalog, ang tawag dyan, manunuba. And to my mind, it's up to them. If they don't pay, kung may mangyari dyan, then sila bahala. Nasa konsyensya nila yan pag may namatay.
Now, the Red Cross stopped conducting COVID-19 tests on October 15 due to PhilHealth's failure to pay its bill. Now, Gordon says this means a reduction of 12,000 tests per day. Back to you, Pia.
Joy, Senator Gordon warning of the adverse effects of the situation, including an increase in testing costs. Tell us more about this.
That's right, Pia. Since the Red Cross stopped testing arriving OFWs, some of them have had to wait longer for the release of their test results, which were done by other health firms. Now, Gordon says he received information that some companies are taking advantage of this. He notes that one company offers a rush processing of COVID tests for 10,000 pesos to release results in 24 hours. Or for 12 to 20,000 pesos, results can be released in less time.
Siyempre, iba nagmamadali. Yung mga nagmamadali, yung palagi natatamaan dahil nagmamadali sila ng mates, ayaw na tumira sa hotel. Sa mga airports yan. You're taking advantage of the misery of other people. That's a mortal sin.
Now, in a statement, the government's one-stop shop denies it is forcing OFWs to go to private RT-PCR test providers, which are charging more. Now, it maintains the government is paying for the COVID tests of OFWs. The one-stop shop says 12 government laboratories are working together to test OFWs after Red Cross stopped its testing. And it says the results are released in 2 to 3 days. Pia?
Joyce, didn't Gordon also warn that there may be a spike in the number of COVID cases because of this situation?
That's right, Pia. Since the number of tests have been drastically reduced, so many are not getting tested. So there may be positive cases out there unknowingly spreading the virus. Gordon expects a surge in the number of COVID cases soon as a result. And as much as the Red Cross wants to resume testing, Gordon says they need the government to pay up first so his office can buy additional test kits. Back to you, Pia.
Joyce Ilas there reporting.